Hello, everybody. How are all of you doing? I hope all of you are fit and fine and taking good care of yourself. I also hope that you're wearing the mask, you're maintaining social distancing, you're staying home, and you're taking good care of yourself. I am Balaka. I am the founder of Interstitial Cystitis India. Today, before I begin, I just want to share a good news with you. The good news is this, that now I am a certified diet and nutritional health coach. I have started guiding patients regarding their diet modification, their lifestyle changes, their stress management, and whatever is necessary to help them reach their healing journey, help them reach their goals in life, their health goals in life. So from that, I would like to discuss a question that I am often asked by patients. They often ask me that, Madam, we are following the IC diet. We are not indulging in any kind of trigger food. We are not eating spicy food. We are not drinking tea or coffee. But still, why don't we see any improvement? Yes, not all patients will see changes in their symptoms only with dietary modification. Why? Because there are different subtypes of IC. So today in this video, I will be discussing about the phenotypes or subtypes of IC. Now, this is little bit of a topic that is debated among doctors and researchers, but as patients, let us not get into the debate and try to understand this as layman, just for our basic understanding. So you must have observed that IC symptoms are not same for all. For some it is pain, for some it is frequency, for others it is urgency. Why so? That is where the concept of phenotype or subtype comes, because every patient has a different type of IC. So there are basically 5 subtypes or phenotypes, but I would say that broadly we can divide it into 2 types. One is the IC that has ulcer, the other that does not have ulcer. The one that has ulcer is the type where the patients also have Hunner's lesion. So Ic recently said that Hunner's lesion should be treated as a different disease and it should not be clubbed with IC. If you have Hunner's lesion, if you fall into that category, approximately 10% of patients, they have Hunner's lesion. So if you have Hunner's lesion, then diet won't really help you that much. If you have Hunner's lesion, then you have to follow a very different treatment protocol that would include fulguration, laser, and more invasive form of treatment. Just making dietary modification won't help you at all. And for patients with Hunner's lesion, even the regular medicines that are given to IC patients, that also doesn't work. So if you have Hunner's lesion, you have to go for a more invasive therapy. So now remains the remaining categories. So the remaining categories, the first type is called the bladder wall phenotype. The bladder wall phenotype are those where the IC starts with UTI, recurrent UTI, chronic UTI. So those patients, their symptoms would be more like UTI types, more they will feel that they have urinary tract infection. These patients, for some, it starts because of recurrent UTI that causes damage to the bladder wall. For some, it can start with a chemotherapy. For some, it starts due to excessive usage. Those who drink a lot of alcohol, a lot of soda, a lot of coffee, for some them also it can be a type. And also for a few patients, those who have some hormonal issues. So this is the type of this is the phenotype where diet modification helps. This is the type where diet modification, pentosan, these actually work. And if you follow the diet, if you take the medicines properly, you will see a change in your symptoms very soon, more or less, because this is these patients, they actually improve with diet and other lifestyle modifications. The second type is the myofascial pain phenotype. These people, they have pelvic floor issues. They have tight pelvic floor muscles, and this can happen because of, if you have been a sports person, if you have had injuries, if you have had traumatic childbirth, traumatic like where you had natural childbirth with some complications. These are those places where you have some issues with your pelvic floor therapy. These patients, they improve if they undergo pelvic floor therapy. So if you fall into this category, then apart from diet modification and medicines, you should also consult with a pelvic floor therapist. If you do not have access to pelvic floor therapist, then you can start stretching exercises, yoga, and these also help. So with stretching exercises, where you try to and there are a couple of books also that you can read. I'll leave the links of those books. Those books, they also show exercises that will help you. So these are the third type. The fourth type are the Neuralgia phenotype. These people, they have pudendal nerve compression. Their pain, they have this burning pain, and their pain usually also goes to their legs and their back and everything, and they also feel movement, they also feel pain on movement and these. So these people, they also won't benefit a lot from diet. So these people, what they need is, they need nerve blocks, they need trigger point injections, they need physical therapy. So if you fall into this category where you have this electrical pain going through your body, if you feel pain on movement, and if you feel that your pain is, kind of making those tingling sensation everywhere. So if you have these issues, then I would suggest that you should go and meet a pain therapist. So a pain therapist would be able to understand your trigger points. They would understand where you have those trigger muscles issue, where you have those muscle issues, where you have those so they will give you nerve blocks, trigger point injections, and that will help you. The last and the final category, they have multiple pain disorders. These patients, they don't only suffer from IC, but many of them, they also have IBS, irritable bowel syndrome, they also have vulvodynia, they also have fibromyalgia, they can also have back pain issues, and a lot of other issues. These are the people, they also have other kind of sensitivities. They can be sensitive to touch, they can have skin problems, they can have sensitivity towards light, smell, food, allergies. These are a very complicated segment of IC patients. So for them, you need to have a very, very multidisciplinary approach, where you have to work with a pain therapist, you also have to deal with the other conditions. So if you also have vulvodynia, then you also have to take care of your vulvodynia. and your IC. If you have fibromyalgia, then you have to take care of your fibromyalgia and IC. So these are the people also, those who won't benefit only from diet or only from medicine, because they also have other issues, and one issue flares up the other issue. So they are related. So if their IBS flares up, their IC will also flare up, or vice versa. If their IC flares up, their IBS will also flare up. So these people, they need a more comprehensive treatment. So I would actually like to talk that I have seen that patients who there are another category that I wanted to talk about, is that in India especially, many patients are misdiagnosed. Often they are told that you have IC, but later on we find out that the person had something else. In some cases, even something as extreme as cancer, end stage cancer. I know of a particular patient who was treated for IC for a very long time, but later on it was we saw that he actually had cancer. Some male patients especially, they also have prostate issues, and that often they are not treated for the prostate that well, and they are treated for IC, and then the medicines don't work. So because there are so many overlapping issues, so if you have been misdiagnosed, then also again diet may or may not work, because if your condition is something else, then however how much you follow the IC diet, you won't see any improvement. So the first thing is to get diagnosed properly, that if you have IC or you don't have IC. Secondly is to understand what kind of IC you have. Do you have nerve issues? Do you have pelvic floor issues? Do you have sensitivity issues? Do you have digestion issues? So these are the things you have to take into consideration, everything. And that is the reason why I always say that for IC, just going to one urologist may not help. So you also need to work with a dietitian, you also need to work with a pelvic floor therapist, a pain therapist. So there are you have to have a very multidisciplinary approach, and that is when you will see some improvement. So today this is more or less I wanted to talk about. I hope you understood. If you have not understood, then you can always email me. I'm there to answer. And I would be talking about another topic that is something very close to my heart in my next video. So stay tuned. My request is, if you are an IC patient, then please subscribe to this channel, click the bell button, so that next time when I make a video, you can have access to that. So this is all. Thank you very much. Stay well, stay fine. See you soon. Bye bye.